Hello listeners, welcome to another episode of the podcast on tobacco control. I'm Mwaka Nyimbili, Center for Trade Policy and Development Communications Specialist. The World Health Organization predicts that the number of smokers in Zambia will increase by an additional 300,000 people by 2025. According to the Ministry of Health, over 7,000 tobacco-related deaths are recorded annually, with youths and adolescents being the most at risk. It is against this background that we are hosting a podcast to discuss the status of the Tobacco Control Bill with the Ministry of Health. I'm so excited to have a special guest from the Ministry of Health of Zambia. Welcome to the CTPD podcast on tobacco control. Briefly, tell us a bit about yourself and what you do.
Okay, thank you very much and welcome to the Ministry of Health. My names are Chrispin Sichone and I'm the Director for Health Policy and Planning. My core duties legislation and policy formulation for the sector. So I deal both with the parliamentary business as well as the cabinet business.
What kind of work are you conducting as the Ministry of Health on tobacco control?
Okay, thank you very much for that question. I think following the ratification of the World Health Framework Convention on Tobacco Control, which took place on 24th May 2008. As a ministry, we commenced the process of domesticating the framework. It has been a very slow process because of various factors. When we started in 2008, we progressed up to some level, but when the CAB memo was sent to have this approved by Cabinet, it was sent back. I think we tried in 2010. In 2014, they said you need to do more consultations. From 2014, there was a bit of stalling of the process, but starting 2018, we again started the process.
What happened when the CAB memo was submitted?
Now, when we did the CAB memo this time, we are told that we need more consultations with the stakeholders. But the main challenge has been with the interference by the tobacco industry. In that, like the last time, they went to the SC, that is the Secretary to the Cabinet, and said that we have not been adequately consulted. So we are sent back. So we called the industry, though ideally we are not even supposed to consult, but in the interest of making progress, we had a meeting with the industry.
What has necessitated the delay in domesticating the WHO Framework Convention on Tobacco Control?
On 11th August this year, Cabinet sat. Okay, I think we had 23 out of 26 ministers supporting the Cabinet memorandum, that is supporting the approval in principle to domesticate the WHO FCTC. When the CAB memo came up, when Cabinet sat, some ministers raised the issue that we don't need to domesticate. Tobacco could be controlled using the Public Health Act. And because of that argument, the chair for the Cabinet, who is the President, directed that the Secretary to Cabinet should convene a meeting where Ministry of Health, Ministry of Agriculture, Ministry of Commerce, Trade and Industry, and Ministry of Justice, and the Ministry of Technology and Science should meet and agree whether we can control tobacco using the Public Health Act. I think 3 or 4 attempts were made, but we didn't. This meeting up to now has not taken place. But in the interest of facilitating or quickening the process, what we did was that we wrote seeking legal opinion from Ministry of Justice whether it is possible to domesticate the WHO FCTC using the Public Health Act.
What was the timeline taken for domesticating the framework, and what challenges did you encounter along the way?
The main challenge has been with the interference by the tobacco industry, in that, like the last time they went to the SC, that is the Secretary to the Cabinet, and said that we have not been adequately consulted, so we are sent back. So we called the industry, though ideally we are not even supposed to consult, but in the interest of making progress, we had a meeting with the industry. They agreed in principle, and we said, now that we have agreed on a position, you submit your submissions in writing, which they never did. So when we tried to submit the CAB memo to cabinet again, particularly the industry and the Ministry of Commerce, Trade and Industry raised the issue for the need to conduct an impact assessment. We did the impact assessment, and the report was approved by the Business Regulatory Review Agency. I think that should have been in 2020. And then after that, we circulated the CAB memo to all the line ministries, which is the normal procedure.
There have been reports that the industry players intend to introduce nicotine pouches. What is the ministry doing about this?
They wanted us to participate in the standardization of those things. So we said no, because these nicotine pouches are a very effective way of introducing people to tobacco smoking, in that, the substance that is responsible for tobacco addiction is nicotine. So what they are doing is that they want to introduce this on the market, and those people that start taking nicotine get addicted to nicotine. The day they run out of the nicotine pouches, the cheapest and easiest source of nicotine is tobacco. So it is a smart way of trying to initiate as many people. So again, we wrote a letter to Justice seeking for legal opinion. In fact, it was not legal opinion. We requested that we ban the same on the market. Justice said you can't use because you see, when you do a statutory instrument, it is secondary legislation. So it has to rely on an act of parliament. So in trying to ban nicotine, we referenced the Public Health Act. Justice said you can't use the Public Health Act to ban nicotine pouches, because the Public Health Act has nothing to do with tobacco. It is dealing with infectious diseases. So we have two points of view that work against the recommendation that we can control tobacco using the Public Health Act. So the opinion that came from Justice on nicotine, as well as the specific one which we asked whether we could domesticate the tobacco framework using the never worked. They clearly stated that we need a separate bill. So the hiccup now is just holding that meeting.
How feasible is the implementation of this piece of legislation?
It is feasible, because Zambia is not the first country to pass such legislation, but we will need to, because to facilitate the smooth operationalization of the bill, the new act, we need to develop some statutory instruments, which will be anchored on the new bill, and therefore we don't expect any problems, because once it's passed as law, well, everyone is bound; they are supposed to abide. But we know that the industry may not sit back; they may also start their processes of. I don't remember any country where they've just sat back. In fact, even the delays that we have experienced so far, it is mostly due to the interference from the tobacco industry. So it is very feasible, and the ministry and other stakeholders are ready to implement.
What are the health implications to people that take these substances?
We are losing a lot of people. The number of cancers is on the increase. The number of young ones that are getting addicted to tobacco and nicotine is also on the increase. So it's very urgent that we start implementing the act that we look forward to enacting. And our target, if things go as planned, is that in the next legislative sitting, which is the first sitting of Parliament next year, we are targeting that. If we can have the bill enacted, well and good.
Lastly, what are your thoughts on people that are contemplating quitting smoking?
For members of the public, mine is just to urge all members to help. Issues to do with health is not a preserve of only Ministry of Health. That's why we now talk of health in all policies. So the members of the public are very key if we are to control the use of tobacco. We are not against the tobacco industry, but it's the use, because you are in a bus, people are smoking and exposing others to smoke. They don't care who is inhaling that. And then we've seen an increase in the number of young ones. You see, if you spoil the young ones, then the future is damaged. Previously, we had a situation where mostly it was males that were smoking. But the last study that was done, the prevalence or the number of girls that are smoking has almost tripled. And that is a very big worry, because the girls are the mothers, meaning they are also the people that stay with the children most of the time. So our future generation and the new babies and the young ones are likely to be more exposed. And the more you expose them, then the problem of the tobacco will keep growing. And therefore we urge the public to support the government in controlling the tobacco use and exposure to tobacco smoke in Zambia.
Well, listeners, there you have it. We've come to the end of this podcast. Do join us again for another exciting topic.